Good morning, everyone. Thank you for joining us on this morning public hearing. On behalf of the members of the Standing Committee on Executive Appointment and Investigation, we'd like to welcome Governor David Apatang and Lieutenant Governor Dennis Mendola's representative, Ms. Joanna Aquino, along with Amishai, the appointees, Dr. Tiffany Lynn Willis, and Mr. Theodore R. Parker, elected officials, dignitaries, and members of the general public. Before we proceed forward with this public hearing, let me first introduce the members of this standing committee. To my right side of the aisle is Senator Jude U. of Snyder from the 2nd Senatorial District in Ian. And next to him is Senator Manny Castro from the 3rd Senatorial District, Saipan. And to my left side of the aisle is the floor leader of the Senate, Senator Dauno Manglonia from the 1st Senatorial District, Rhoda. And next to him is Senator Ronnie Calvo from the 1st Senatorial District, Rota. And I'm the chairman of this standing committee, Senator Francisco Q. Cruz from the 2nd Senatorial District in Ian. I would also like to announce a couple of things in the interest of informational purposes regarding code of conduct during this public hearing. Today, the members of this standing committee is conducting a public hearing on the appointments of Dr. Tiffany Lynn Willis, representing the physician's profession, and Mr. Theodore R. Parker, representing the healthcare professionals for the Healthcare Profession Licensing Board. The public will be invited to make comments as to whether you support or oppose the appointee before us this morning. We value your input. However, any comments beyond the facts of the appointee or comments that are not directly related with this public hearing will not be entertained, and such comment will be removed from the record. At the same time, please observe minimal noises in disrupting this hearing process. And please turn your electronic to a silent mode. Thank you. Let us now begin. This public hearing is now in session. Today is November 21, 2025, at approximately 9:13 in the morning, here at the Vice Speaker Suspi Mopnas Memorial Building, Capitol Hill, Saipan. This is a public hearing regarding the appointments of Dr. Tiffany Lynn Willis and Mr. Theodore R. Parker by Governor David M. Apatang and Lieutenant Governor Dennis C. Mendola to serve as the members of the Healthcare Professions Licensing Board. Ms. Jolene Tagro, our Senior Legislative Assistant, who is assisting us. Our Sergeant Arm will be Sergeant George Lai. LJ will be in charge with LB social media, and our IT will be Jonathan Diaz, and our legal counsel will be Joe Bermudez, and they will all serve accordingly for this public hearing. At this time, I would like to ask Ms. Tagabot to please call the roll.
Senator Ronnie M. Cabo,
Present.
Senator Manny T. Castro,
Stiga.
Senator Francisco Q. Cruz,
Here.
Senator Jude U. Schneider,
Day.
Senator Karina Omagofnia, Senator Donald M. McButton.
Present.
Mr. Chairman, 5 members are present, 1 member is absent.
Thank you, Ms. Tagabot. With 5 members present, we have the necessary number to proceed with this public hearing. However, the Vice President of the Senate, Senator Magofnia, is excused. At this time, do I hear a motion to adopt agenda? There's a motion and was seconded. All in favor of that motion, say aye. Opposed, say nay. Motion carries. At this time, I'd like to ask Sergeant Terlar to please escort the appointees and the governor's rep into the chamber. Thank you. Ma'am, and before you proceed with your testimony, please state your name for the record. Thank you.
My name is Joanna Kino, representing the Office of the Governor and the Lieutenant Governor. Buenos and half a day and good morning, Chairman Francisco Q. Cruz and the honorable members of the EAGI Committee. For the record, my name is Joanna Kino, Special Projects Coordinator under the Office of the Governor. And on behalf of the Honorable Governor David M. Apatang and Honorable Lieutenant Governor Dennis James C. Mendiola, I thank you for the opportunity to appear before you today. I am pleased to introduce Dr. Tiffany Lynn Willis and Theodore R. Parker, who has been renominated by the Governor and the Lieutenant Governor to serve on the Healthcare Professions Licensing Board representing healthcare professional. By now, you should have received their resume, which details their professional experiences and educational background. Dr. Willis and Mr. Parker have demonstrated exceptional leadership and unwavering dedication to the board's mission of safeguarding public health, safety, and welfare through the regulation of healthcare professionals in the Commonwealth. Their deep understanding of the regulatory framework, strict adherence to ethical standards, and extensive institutional knowledge have been crucial in guiding the board through important updates in policy and procedural practices. Governor Apatang and Lieutenant Governor Mendiola are confident that they are well prepared to answer any questions you may have and present their vision for the future. We kindly ask for your expeditious approval of their renomination to the Healthcare Professions Licensing Board. Thank you, Sizuz Maasi, Zengula So, for the opportunity to introduce them to this august body.
Thank you, Mr. Kino. And before I recognize the appointees, I would like to ask both of you to please rise so that our staff can administer the oath.
Please raise your right hand. Dr. Tiffany Lynn Willis and Theodore R. Parker, you do solemnly swear under the penalty of perjury that the testimony you shall give in the matter at hand shall be the truth, the whole truth, and nothing but the truth. Thank you.
Thank you, Ms. Tagabel. And I would like, you can sit down, I would like first to start with Mr. Parker. And sir, before you proceed, please state your name for the record. If you have anything else to share this morning, I know that both of you submitted all required documents, but if you have anything else that you wish to share to this committee, you have the floor. But before you proceed, please state your name for the record. Thank you.
My name is Theodore R. Parker. I'm currently the chairman of the Healthcare Professions Licensing Board, and I just wish to say that I sincerely appreciate the opportunity to continue to serve on this board. I think we have a great group right now, and we have a lot of work to do and a lot of things coming up, and I'd just like to see that through. Thank you.
Thank you, Mr. Parker. You can go ahead, Ms. Willis.
Hi, I'm Tiffany Lynn Willis. I'm a member on the licensing board, and I also want to thank you all for the opportunity to continue to serve there. Through the years, we've been able to implement a lot of different changes for the better, I think. And again, like Mr. Parker, I'd like to be able to continue implementing those and safeguarding and providing great care for the CNMI.
Thank you, Ms. Willis. And before I recognize the members of the general public to participate, first I would like to recognize those that are invited. First on the list, Ms. Esther S. Fleming, Executive Director of the Board of Professional Licensing. Can you please come forward if you have anything to share with us? And again, before you proceed, please state your name for the record. Thank you.
Oh, they already read. Good morning, everyone. My name is Esther S. Fleming, and I'm the Executive Director for the Healthcare Professional Licensing Board. Honorable Chairman,
Frank Cruz, members of the EAGI, Senator Manny, Senator Jude, Senator Donald, and Senator Ronnie. Good morning. On behalf of the Healthcare Professional Licensing Board, I take this opportunity to thank Governor David M. Apatang and Lieutenant Governor Dennis Mendiola for their confidence in renominating Mr. Ted Parker and Dr. Tiffany Willis to continue to serve on the Healthcare Board. The Healthcare Board is composed of 5 members. We do have currently 2 physicians, 1 physician, 1 vacant, 1 dentist, and 2 healthcare professionals who are not physicians or dentists. Currently, we have 1 physician position that has been vacant since January of early this year. Dr. Tiffany Willis' term expired on January 19, 2025. Because of her institutional knowledge and expertise across most of the regulated healthcare professions, the board approved retaining her to continue serving on the board until a successor has taken office, which is also authorized under Public Law 15-105, subsection 2204E4. Mr. Ted Parker is a pharmacist, and his term will expire this coming January 19, 2026. I have known the 2 nominees for over 9 years now, and as the executive director for the Healthcare Professional Licensing Board, they both have earned my utmost respect and admiration for the services they have been providing, protecting the public interest and the health, safety, and welfare of the people of the Commonwealth. For Mr. Ted Parker, during his tenure as chairman, since he came on board in 2013, 2014, yeah? Something like that. He has shown exemplary leadership and unwavering commitment to the board's mission. His extensive understanding of the regulatory framework, his dedication to ethical standards have guided the board through key policy updates and procedural improvements. Dr. Tiffany Willis also has deep roots in the CNMI, and she's been here for almost 23 years, right? That's what I call homegrown. To all of them, they're homegrown, staying to survive in all our ups and downs, and has been an invaluable member of the healthcare. Her continued service will greatly benefit the board, the regulated healthcare community, and the people of the Commonwealth. During her tenure, Dr. Willis has consistently demonstrated professionalism, integrity, and an unwavering commitment to protecting public health and safety. Her extensive clinical knowledge, coupled with her practical experience in healthcare delivery, has greatly improved the board's decision-making, and policy development. Dr. Willis's approach matters before the board with fairness, diligence, and a deep understanding of the complexities surrounding the healthcare practice in the CNMI. In addition, Dr. Willis provides thoughtful leadership and a collaborative spirit that strengthen the board's ability to address emerging issues, maintain high licensure standards, and ensure that only qualified, competent, and ethical professionals are authorized to practice. For these reasons, the Healthcare Professional Board respectfully recommends and supports the reappointments of Mr. Ted Parker and Dr. Tiffany Willis to the Healthcare Board. The continuity of having members with institutional knowledge would be immensely valuable as the board continues to modernize its processes, update regulations, and improve oversight of more than 33 licensed professions. I am confident that their continued service will help sustain the board's mission of safeguarding public health, safety, and welfare. Mr. Chairman, I respectfully urge your committee members to take favorable action on Mr. Ted Parker and Dr. Tiffany Willis' reappointment and endorse their continuation as essential members of the Healthcare Professional Licensing Board. Thank you for your time and the privilege for testifying before the Chamber on behalf of the 2 nominees. Thank you.
Thank you, Ms. Fleming. Next, any member of the Healthcare Professional Licensing Board is here. You can come forward, please, sir. And before you proceed with your testimony, please state your name for the record.
Good morning, Chairman and honorable members of the Senate. My name is Dr. Marty Rohringer. I am the Deputy Chief Medical Officer at CHCC, the EMS Medical Director, and also the Vice Chair of the Healthcare Profession Licensing Board. I'll keep this brief. I know you're busy and it's Friday. I'm pleased to recommend the renomination of Mr. Ted Parker and Dr. Tiffany Willis to the CNMI Healthcare Professions Licensing Board. As chairman, Mr. Parker has demonstrated exceptional leadership, professionalism, and steady commitment to safeguarding healthcare quality in the Commonwealth. Dr. Willis has been an anchor on the board, diligent, thoughtful, and consistently focused on patient safety and regulatory integrity. Their continued service will ensure stability and experienced oversight as the board advances its vital mission on behalf of the people of the CNMI. Thank you for your time.
Thank you, Dr. Rohringer. Any other member? No one else? At this time, I would like to open the floor for any members of the general public that are in the gallery that wishes to come forward and deliver testimony, whether you're in support or not. You're free to come forward. But again, I would like to remind anyone that wishes to deliver testimony that any comments that is not directly related with this hearing will not be entertained, and such comment will be removed from the record. At this time, I open the floor for public comment. Anyone, please come forward. If no one, at this time, I would like to close the floor for public comment, and I would like to ask Ms. Jordan to disclose all written testimony submitted.
Mr. Chairman, members of the committee, Dr. Willis, Mr. Parker, and members of the general public, in addition to the oral testimonies received today on the executive appointment of Dr. Tiffany Lynn Willis and Theodore R. Parker to serve as members of the Healthcare Professions Licensing Board, please be advised of one additional written testimony officially received in support of the appointee from Esther S. Fleming, Executive Director of the CNMI Board of Professional Licensing Board and the Healthcare Professions Licensing Board. At this time, no written testimonies in opposition of either nominees has been received by the committee. Thank you, Mr. Chairman.
Thank you, Ms. Dagobert. Now I would like to recognize the members of this committee. I recognize Senator Hoff-Snyder.
Thank you, Mr. Chairman. Good morning, members. Good morning, staff. And good morning to the nominees. Ms. Fleming, welcome back to the legislature. Dr. Rohringer, and also to the great staff from the administration, Joanne and Amy. So, first, thank you for accepting this additional responsibility in the midst of your primary responsibility as physicians and pharmacists, respectively. I'm looking at the citizen-centric report for 2023. Just looking at the stats. Just curious, do you guys license also for? There's been a big push for behavioral health professionals, mental health, so to speak, counselors and all. Does that fall under? Do you think that does it fall under your purview to license any of them coming in, or is it a different different category of patient care?
As I understand it, with the list of healthcare personnel that we do license them, that does fall under our purview and our authority to license them. I know that there has been several amendments to the regulations concerning mental health professionals with a diversification of different job titles with different types of accreditation. So I think in the beginning we had maybe 3 or 4 different categories of mental health professionals, and I think that's now up to I believe it's 8, depending on the specialty of each individual and what they're doing, anywhere from psychologists, psychiatry, all the way to drug rehabilitation specialists and those types of areas.
Okay, so yeah, just to your statement. So there's, I guess they fall under professional counselors. There's a marking of this: professional counselor, social worker. Sorry, let me blow this up. Psychologist.
Right.
So, yeah, there's, based on the report that I'm looking at, there's 11 active, and that again, that's from 2023. So then they just passed the 2024 and 2025. The reason why I asked this question, because there seemed to be a the need in the community nationwide, and especially here in the CNMI. I'm also in support of taking care of those people, however it is that we can, through credentialing and oversight. In the legislature, we adopted some measures to build capacity here. One of which the behavioral health scholarship to build capacity locally, in hopes that when they do the proper credentials, they would stay back and serve the community that's in badly need of that service. And the other one is the professional student exchange program, both being administered by the scholarship program here, of which there are 10 elements of medical fields that are qualified under the PSEP, the Professional Student Exchange Program, and I'm certain that one of them is behavioral health as well. So, coming from this side, I ask that we continue, reaching out to our constituents. I do know that in the previous years we've also supported the drug court, and we supported the Hope Center. We supported, other elements that are one way or another related to the clientele. So, do you want to speak for that? Any of you? Do you want to speak for that? What's your view as far as that is concerned? Because everything requires support. Not only the personnel but the funding.
I would just say that I agree with you 100%. Through the years, we've been so short mental health providers. There is a great need. Some of that occasionally is filled by telemedicine, which we've worked through in the board and in getting people licensed and being able to do telemedicine with connection with people here as well. And we'd work, obviously, getting any legislation done that helps with that. I know one member of our team, Glenda George, in the mental health fields, has worked extremely diligently on getting things set up with passage of legislation that helps. So I'm grateful for that. I think it's still a recruitment issue. Just from either stateside, or I agree with you, homegrown is the best, because most of the time they'll stay and help out. I just, across the board we need help, but mental health for sure is one of the areas nationwide also that's very both important, but not many people are addressing the need to fill that. So I'm hoping also here we're able to garner more support for mental health.
Yeah, do you want to say something, Ted? Or no, you're good? I asked this, and I want to go on record saying such, because it actually matriculated into a bigger need in the community, and it goes to also to the primary education. We hear it, from our institutions, PSS. They have this mental health month, behavioral health, but we also have another. The other opposite side of that is the synthetic cause of it. And it's a big issue, definitely. We want to support them, but we also want consistency and see how we can make sure that the level of care is there. Because at the end of the day, right, we want to, what's the word? And I don't know if that's the proper terminology, but I'll park that for now. But yeah, I mean, we want to get them back in the community to be contributing members of the community. So I ask respectfully that if and when confirmed that we kind of focus on that as well. I have a couple other questions, but I think it's gonna require a little more time, so I'm gonna go ahead and withhold my question and I'll yield some of my time to the other members. Thank you. Thank you so much for coming. Appreciate it. Will you back, Mr. Chairman?
Thank you, Senator Snyder. Now I would like to recognize Senator Castro.
Thank you, Chairman, and welcome, Dr. Willis and Dr. Parker. Thank you for your continued service. Just looking at the resume, we really appreciate that. I'm sure our community appreciates that. The question, I just have one question, and due to the shortage in medical professionals, not too long ago, Senator Donald offered a Senate bill to help with the foreign licensures and practice here in the CNMI. Let me try and get that actual bill. That was which became Public Law 23-33, which would give you guys a bigger scope in terms of regulating foreign or practitioners from foreign countries. Have we already started like with the rules and everything? Is it already in place?
Actually, yeah, the regulations are already in place, and we do receive applicants on a regular basis from foreign physicians wishing to practice here. The purpose of that bill and the purpose of the regulations is to get specialties, people that have specializations that are relatively high cost individuals that if you were to bring them from the continental United States. So the purpose is to be able to attract these specialists in nephrology or whatever medical specialty to come here and practice. The regulations provide for a vetting process that is very rigorous, and to my knowledge, we've only been able to license one individual under these regulations. But the process is there. The regulations are there. I think there's some amendments coming up just to kind of tweak as we learn more about how the process goes, but it is progressing.
Okay. I just wanted to thank you guys on your work with that. I think it makes a lot of sense given that our proximity to a lot of to Asia, and rather than a lot of our medical referral is mostly lodging and travel, and if we can do the reverse of that by bringing more providers here, then we don't have to refer as much. So I commend the author on this legislation and the administration for making it law, pretty much. And the other question just tied to that same question, what other is there anything we can assist in terms of helping? Because I know credentialing, like verifying credentials, can be a challenge. Although I don't have experience in the medical field, but in higher ed, there's actual agencies that assist with transfer credit evaluations. And is there any way we can help with that regard, or any, or is everything going good so far?
This is something that it comes down, I guess, to you guys also, is just the funding for an investigator, because unfortunately we've been without one for so many years. It's very difficult we do a pretty thorough job of vetting, but when it comes to this, it's just so helpful to have somebody investigating for us. That that would be incredibly helpful to get the funding for that.
Thank you, Chair. You.
Thank you, Senator Castro. Now recognize Floor Leader Manglonia.
Thank you, Chairman, and good morning to the nominees. I want to share the sentiment of my colleagues who spoke before me, and I just want to thank you both for the services that you've provided, not just to the Healthcare Professional Licensing Board, but to the Commonwealth as well. I mean, both of you are being renominated for a position you've held within the board. And I also want to thank Senator Castro for bringing up Public Law 23, and it was a result of the work with Dr. Marty and the wonderful people at CHCC to help push this legislation through. I did see that, I think it was at MAI where the first licensed professional came in for, and I hope that in the future, we also address the lack of mental health specialists. I know you've briefly mentioned that with Senator Hofschneider, but in regards to the mental health area, how much of a challenge has that been in trying to provide the telehealth access to our people? And I bring that up because, on Rhoda too, we're going through something right now where we're trying to provide support for some of our people, but it seems unclear as to what the hospital can do to assist the individual. And so in terms of your experience, or in terms of any advice that you can give to help facilitate that, is there something that you can offer right now that maybe we can look into?
In terms of mental health services, as we mentioned before, with telehealth services, we have looked at extensively. And for the most part, if someone has a computer, they can go online and they can find anybody. And the issue that our board has always had is that the credentialing of these individuals, because they're seeing their patients here. So it's very difficult to monitor, but what we've been doing is pushing this forward so that telehealth in general can be more available to the people here, and especially to the outlying Teni and Rhoda Islands. I think in terms of what we can actually offer, I'd probably have to go with Dr. George on that to find out what she's been doing lately. She's our mental health specialist on the board and would have a lot more information for that. I know that she's doing a lot of programs locally to get more patients in and to be seen by qualified personnel. But in terms of providing more services to the island of Rhoda and the island of Tini on a remote basis, I'm not sure exactly where she is with that, but I know it's being worked on. Yeah.
Have there been any issues in regards to maybe the requirements that are needed to get certified that have become challenges for some of the interested applicants that maybe they're not wanting to look further into and coming into the CNMI that maybe has become an issue through your experience?
In terms of having the regulations being too strict for people?
Right.
And
or are they
them
pretty standard? I mean, compared to the rest of the U.S.?
Well, we base a lot of our regulations based on what other states and what the continental United States is doing. So a lot of the things that we have is based on what other states have done. That way we don't have to reinvent the wheel. So, which is one of the reasons why we have so many different types of mental health professionals now, because there's so many different categories from the lowest, if you want to speak of it that way, all the way up to clinical psychologists. So we have been very good at adopting different regulations for different levels of skill sets for individual mental health workers. So, and that's a continuing process. I believe that we just, wasn't it? Didn't we just pass those? Yeah, it was just this year that we passed the newest ones for those, and I know that already they're being looked at again, and they're going to be amended again to fit the continuing movement of what the needs are here.
Okay.
Yeah.
Thank you for sharing that. I also see that there are, well, at least at, what was reported in the latest published citizen-centric report, there was at least 534 active licenses. Are all of these licenses valid for the same period of time?
Yeah, from the application date to the time they're approved, they're all good for 2 years.
Have there been any changes to the fees for these licenses in terms of renewal, or whether it's new or renewal?
Yes, there has been. We updated our fee schedule just recently. That was done in conjunction with the Attorney General's office, and it was meant to supply funding so that we maintain a full-time attorney on our board. We utilize legal expertise a great deal just because of the nuances of how it fits here in the CNMI as compared to the U.S. mainland.
So this would be a private attorney and not the
No.
AG?
No, this is an AG.
But there's not enough from that increase in your rates to help fund an investigator?
I don't have the budget in front of me, but I don't believe so.
Okay.
That has been discussed during having our fees fund an investigator, and I believe that Esther's working with personnel to try to make something happen with that, but I'm not sure how far in the process that is.
Okay. I don't have much. I just wanted to point some of those issues out. Like I said, Dr. Marty I've worked with Dr. Marty in trying to get this Public Law 2333 passed, and so I appreciate whether it be his role as a board member or his role in CHCC, but I think it's, with that kind of collaboration and partnership, we can assist any way we can in trying to help the board in amending policies that could further assist the healthcare field. But in moving forward, I just wanted to also point out, I don't know if it's part of your role or duty, but more collaboration with CHCC to further address some of the shortages and how we can further attract or even retain some of the professionals that are currently here. Like I said, in Rhoda, one of the biggest challenges today is the mental health aspect and providing the services or even support to try to help those who are needing these services, because like I said, the Department of Public Safety or the clinic they seem unsure about how to proceed with some of these cases. And so maybe even with PSS, working with PSS and any psychologists they have there that could also, I don't know, be licensed through, I don't know if they're already licensed through the healthcare board, but reaching out to them to also see if they can offer these services to outside their current role within PSS, if they do have these positions. I know they have several psychologists there that I'm not, like I said, if they're not licensed through the board, if we can work with them to try to see if they can also offer additional services outside their scope within PSS. Other than that, you both are being renominated, and so I hope that if confirmed and during your time within the next 4 years, if there's anything else that you think we should look into, I hope that you reach out to the legislature to see how we can assist in any way. All right, thank you both, and thank you for your service, and I do not have any reservations in your confirmation, and so I hope that with the support of the colleagues, we can try to get that pushed through expeditiously. Thank you. Mr. Chairman.
Thank you, Leader. Now I recognize Senator Kawu.
Thank you, Chairman. And welcome, Dr. Willis and Dr. Parker. I did get the opportunity to match the faces earlier with the nominees' names, And Dr. Willis, I noticed here this is since the late Arnold that was, introduced for that nomination, Governor Arnold Palacios now, and thank you for the continuation when it was endorsed by Governor David Apateng and Dennis Mendiola and our Senate President to refer to the committee. Yes, just looking over the resume and like you said, homegrown, we're very, very fortunate to have two fine young professionals, invest in the Commonwealth for this length in period. I've been in the educational field for quite a number of years now, and one of the keys that our colleague senators mentioned is how do we retain and incentivize our personnel or people, especially those that are not literally local. That's the biggest challenge. I do take care in the past special education, so the educational aspect, and working with my former, two former directors and the service provisions for children or adults with special needs. Your educational psychologist pool, speech pathology, we call this term tiny eye. I'm not sure if you've ever heard of that. I'm pretty sure you've heard of it because you cross over and network with some of these professional deaf and hard of hearing. We have some of these colleagues that are under my public school system working, and these professionals that I've known for many years now, and to just ensure we educate. I know you guys do outreach education. We have wonderful teams that come from public health, dental. I've seen them. I'm just happy we're grant funded for those things that provide that educational service to the young kids, and inspiring nurses. The nurse pool here. I'm not sure the ratio now, but I know in the past we've had that trend where we're always in that challenge of how do we retain our and keep our professional services on a stable flow. One of the things we did have a recent, me on a personal level, a family member that went through the ER had unfortunately passed away not too long ago. So we're looking, we do have certain clinical physicians, but those that specialize in certain, like for your heart doctor and stuff. So there's just like that supply and demand mode, where we don't have certain surgical opportunities that we would love to have in the Commonwealth, but it's offered like in Hawaii, San Francisco, and internationally, Korea or Philippines, wherever the referral is. So those are some of the, I'm pretty sure this is not new to you, but it's new to me, like some of the things that it's brought up, like, man, how can we overcome some of these barriers? And it's a daily duty. I like the way, thank you, Esther, for your testimony, and also ER doctor. I didn't quite get the name, but I asked Senator Marty or Marty? Marty, Dr. Marty, thank you. I was there in the ER, and, they did a phenomenal job. Not always, you hear these positive, output, but out of all circumstances, I learned a lesson, in regards to how the ER operates, how many personnel or family members you need in that, and everybody works together. So I commend them and our professionals, public health and the clinical area. We do look forward to, if it is the 4-year term and 4 more years and so forth, till you pass the torch to another, member that is nominated. Look at Mr. Parker and Esther, knowing them for 9 years. One of the things is the telemedicine, telehealth portion. We've had in the 90s, 2000s, I've been early 90s, and I've seen the trend of, this is the municipality of Rhode I can speak for, the trend of challenges when the air industry just falters, and then you have the medical demand and trying to get abroad. So I like that we have the you know, the online services for, you know, remote delivery and care, um, and, you know, hoping that it continues to succeed and reduce the healthcare costs needed, you know, and the demand, so we can utilize that funding elsewhere. So, and then just to hopefully help promote more for the educational aspect, the related service providers needed for the educational part. I know, you know, pump in some locals. I'm not sure the stats now, how many, but to help in and the mental health area. So those are some of the little things that was brought up. But thank you so much for your continued service. You know, honored and salute, and we continue to help the Commonwealth with the health care they need. And I just almost thought of I was in Oregon not too long ago. My mother had triple bypass surgery. So it's brought to mind where they had clinical patients, and I know we had the healthcare team earlier on a note with Medicaid, Medicare, and that, but patient receiving care from home, you know, that service and provision. I'm not sure where we're at now. I know you deal with that, but I'm hoping future-wise we can have that in place, because, you know, specialists, sometimes the care has to be in the home setting. We probably have it, but, you know, new to that's your part, but to continue to endorse that we have our locals cared from the home environment, you know, if not more often and so forth. So thank you so much. Thank you for the testimonies, and we look forward to, without a doubt, me personally agreeing to needing, you know, you're immensely valued, like Ms. Fleming said, needing you for this board to continue the healthcare and service needs for our people of the Commonwealth. Thank you very much. Thank you. I yield, Chair.
Thank you, Senator Koval. Recognition, Senator Snyder.
Thank you, Senator, Mr. Chairman. I want to ask this: what has been, and it's just an open conversation, what has been the most challenging as far as your career as someone that is responsible to make sure that you issue or not to issue license to an applicant? I mean, I know it's all perfect, but is there any challenges?
I make a list. It's always challenging vetting people, because in the past we've had several applicants. On paper, they look absolutely amazing. You think, oh, they're going to be the greatest thing since ever for medical care here. And then when you dig a little bit deeper, and now with the internet and AI and everything, you can do that much more easily than you could in the past. You start seeing things that maybe aren't so good. And so you have to distill this down into a conversation that we have amongst the entire board to find out, well, they look good here, but they have these other attributes that may not be so good. So I think for me personally, the biggest challenge I have is making a judgment call on the needs of what we need here in the CNMI versus what would happen if they were outside of the medical providing care. You know what I mean? It's like if you have someone that's a brilliant physician and you find out that they're a child abuser, then you really don't want them here. So I think that would be, for me, the biggest challenge, is making the judgment call on whether someone would be a good fit for here in the CNMI versus they're just trying to escape something from the mainland from another situation. So.
I'll just say it's similar to what Mr. Parker said, is just, again, the vetting and deciding, again, those judgment calls. So I just agree with what he said, pretty much. That would be the most difficult part for me.
Thank you both. So there are some legislations that are floating around. I think, in the Senate. Not in particular a Senate bill, but it has everything to do with service as far as that's related to health. That I respectfully request that. I mean, I know Esther's up and up on this, and that provide some comments when it does float around here, because we get a lot of guidance from the professionals and the SMEs, such as yourself. If legislation that is of critical nature to ensure to improve service to the general being, the general public, we need guidance from your entity. And I'm just talking in general, but in this case, we're talking about healthcare that's relatable. I mean, potentially related to us deciding on something that can definitely appreciate your guidance on it. So I'm gonna request the chair of the health to reach out to Ms. Director Esther and the board, even if it's a conversation like this, because once it goes through, that would be your standard operating procedure, so to speak, to be guided accordingly. So I wanted to mention that. Also, we're not, and I'm gonna say this: we're not immune to, at least us on this side, to hearing concerns raised by our constituents with services, in the healthcare professionals. So I always encourage them to, I said, bring it up the chain if there is a concern. Bring it up to them if there is such. Because when they're already coming to the elected official, that means it's a serious matter, and something that can also probably violate HIPAA or whatever Privacy Act. But we don't want to discourage them from bringing it up the chain, because we want them to be comfortable going to our institution and talking to the people that you issue license to. So I just kind of want to raise that point that we do have that come across our desk, or our phones sometimes, or like out there in the community. So we always encourage them to address it accordingly. To what extent that happened, I can't comment further. So and that's pretty much it. I don't have any reservation, and I'm just thankful that y'all agreed to continue serving. I'm anxious to see how that Manglonia law, Senator Donna Manglonia law, come into fruition in terms of the foreign doctors, how it's going to pan out here. Because I think there's a policy by the Healthcare Network Program, and that they've reached out to foreign hospitals, which is potentially much cheaper, probably same level of care, and it's like 2 hours, 3 hours from here. So I'm really, curious to see how that's going to pan out. So, yeah. So with that, Mr. Chairman, thank you, Doc, and you refer as Dr. Ted? Okay. All right, Mr. Parker. Thank you. How you back, Mr. Chairman? Thank you.
Thank you, Senator Snyder. And good morning, Mr. Parker and Dr. Willis. I think this is the third time that we met and we entertain your reappointments, and I'm glad that both of you continue to accept this volunteer responsibility, although I know that you guys are very busy with your responsibility at the hospital and at pharmacy. I duly appreciate your commitment to continue this board of professional licensing. I know that it was mentioned, I believe it was mentioned by Dr. Willis, that lack of investigator when a member asks questions in regards to any issue. Do we have investigator right now, or still? And I know that from the time that ARPA funds ran out, I think that's a result of not having a investigator, right? And I think it's you guys are operating with only executive director and administrative assistant. There's no others. Have you ever reached out to maybe the legislature or the executive branch for an additional? I don't know whether I want to ask whether do you have a backlog of complaints or any lawsuit within the licensing, either the health or the BPL?
We don't necessarily have a backlog of complaints, but as Senator Jude had pointed out, a lot of times you get phone calls or you have people coming to you in the community or outside of your place of work filing complaints. And the way our board works is that we really can't take any type of action against any registrant unless there is a written complaint. So a lot of these things go undone because we have no recourse but to do nothing because we don't have anything in writing to go on. And that's purely from a legal standpoint. So with an investigator, the advantage of that is that we can actually send them into the field. And so if we have a verbal complaint that is not official, at least we would have the capacity to go into a facility to determine if the complaint was legitimate or not. So it's not that we have a backlog of complaints, it's just that the oral complaints or the unofficial complaints, we don't have a way to reconcile.
Thank you. The reason why I raised this because I cannot blame the office with lack of staff, especially professionals like investigators too. Although there's complaints and there's no staff to to launch the investigation to make sure that we don't get the government don't get a lawsuit, because the government right now we're in big financial situation and we don't want any lawsuit against the government. So that's why I raised this. Maybe perhaps this is the right timing to approach the. I'm not trying to put the fiscal affair chairman on the spot, but this is very critical that we must, furnish that office with the necessary tools to operate efficiently and avoid any future lawsuit against the government. So I'm sorry, Chairman, but I think better to raise this than be sorry later on. Because lawsuit, I don't know if we can afford to, to pay for lawsuit, and we don't know how much is that lawsuit. So that's the reason why I raised this. And also I see the board in regards to amending regulation for foreign professionals into the Commonwealth. Can you elaborate more about that? Any of you? The reason of the amendments? Is that amendment already done or still on discussion within the board? Any regarding foreign doctors that?
Yep. There has been a law passed to allow us to license foreign providers. That's already in the books. We have already written regulations towards that end, but those are very, very recent. So the number of applicants we have is actually, we've had a few and the number is growing, but the implementation of the regulations that we've currently written they haven't been really tested. I think we just have the one, right? Yeah, we just have one physician that we were able to sufficiently vet to allow to license and practice here in the CNMI. So the process is just starting. So I don't have a lot of information about other applicants.
So that primarily that amendment is to limit foreign doctors coming in here?
It doesn't
Just-
limit them. It provides a pathway for them to be here without obtaining a United States license first.
Okay.
And we've streamlined that process to make it a lot more efficient and a lot more able to be successful in recruiting qualified professionals to practice here.
Okay.
So that was the reason. I know in the past there has been talk about foreign physicians practicing here, and the previous regulations were very cumbersome to the point where most foreign physicians wouldn't even try. We've streamlined those with the help of the passage of the bill that did that. So we are in the process of evaluating to see how effective it's going to be, but it is just starting.
Thank you. Dr. Woods, is it the same with you, or you have different thoughts on that?
Yeah, sorry, it's roughly the same. We're just getting started, and we may have to, as time goes on, if there's some areas that seem not to work as well, then we would just come back to you guys with new amendments, I guess, on it, and tweak it a little bit more to be able to work more efficiently. But since we're just starting, we'll start with what we got put together, which we think is really pretty good from you guys also. Thank you. And then we'll just see over the next 6 months, and if we need to amend anything, we'll come back to you for sure.
Thank you. Any other members wishes to? No one else? Are you, well, we're good? Thank you. Thank you, both of you. At this time, all public comments are well taken. Let the record reflect that the written testimonies will be forwarded or will be included in the Senate Standing Committee recommendation report along with oral testimonies, and will be forwarded before the full Senate members in consideration for confirmation. At this time, before we adjourn, I would like to extend on behalf of the members of this Standing Committee our sincere appreciation to Governor Apateng and Lieutenant Governor Mendiola's representative, Ms. Aquino and Amishai, the appointees, Dr. Tiffany Lynn Willis and Mr. Theodore R. Parker, and most especially the members of the general public, for your participation and involvement during this important public hearing process. And we certainly hope that we continue this dialogue of communication between us, the elected officials, and the public to keep you abreast and informed of our current and future Senate hearings ahead that relates to public best interest. This concludes this public hearing for this morning. Do I hear a motion for adjournment? There's a motion and was seconded. All in favor of that motion, say aye. Opposed, say nay. Motion carries. This public hearing this morning is officially adjourned.